Usually, there are certain benchmarks that say, absolutely, you now may be ready. And usually that benchmark is at the 90th day of treatment and you are an insured client. And so now we're ready to transfer you to a state of continuing care.
We use the words transition or transfer to refer to when a patient becomes stable on their medicine at the drug treatment program, and then they begin to see a primary care doctor or perhaps a psychiatrist if they already see a psychiatrist anyway. That other physician will then start to prescribe the medication for the patient. So the patient will then see their primary care doc for buprenorphine medication prescriptions on a regular basis.
We meet weekly to discuss each client, so it's a team decision when a patient is ready for transfer. If they have completed their treatment recommendations of individual or group counseling, we require that they have two-week medication take-homes. They have demonstrated compliance with medication take-homes, and then we work with Baltimore Healthcare Access to get them transferred to the primary care physician.
When you're ready for the transition to a continuing care doctor, your BHCA advocate's going to meet with you. We're going to discuss with you where you might want to go to the doctor, how you're going to get there, and whether you can afford your prescriptions.
They'll do the paperwork for you. They'll make the appointments for you, but it's up to me to do the footwork.
By you being a part of the BBI program, wherever you're transferring to, they know where you're coming from, and they've already dealt with a lot of clients in your position.
The treatment advocate was a tremendous help getting me ready to go to the doctors. How it was going to be when I get there, as far as me getting my prescriptions and seeing the doctor and what I had to do.
The physician is aware of your dose and your treatment protocol. We complete a transfer summary that lists your dose, any other medications that you may be on, and your frequency of group or individual counseling here at the program.
Your BHCA advocate will meet with you prior to your first appointment with the continuing care doctor. We'll make sure you know how to get there, which bus lines to take, what to expect. We've been to most of these doctors' offices and can tell you exactly how to get there and what your experience will be like.
When you go to a primary care doctor's office to get your Suboxone, you're making an appointment just like all the rest of the patients in that primary care doctor's office, because the doctor is taking care of your health in general. And by the way, they're writing you a prescription for Suboxone.
You get comfortable with where you are, and for most addicts, change is quite difficult, but we're there to guide you through your transferring process.
A new doctor and forming a new relationship can be somewhat stressful, but this doctor is also very familiar with clients who are Suboxone or buprenorphine maintained, and they're familiar with clients coming in from a treatment network and what needs to be done.
To hear that patients feel anxious or worried about the transfer process is very normal. We hear this, and it's one of the areas that we're most concerned about. For patients who get into drug treatment, just to become stable at the program is a great accomplishment.
I was a little nervous at first, but once I got to the office and I talked to the nurses and the doctors, they made me feel a little at ease.
Your treatment advocate will be available the whole time that you're with your continuing care doctor, whether it's 2 months from now or a year from now. If you need help finding a meeting, a new doctor, or you need help with your health insurance, you can give us a call and we'll help.
After you transfer, absolutely, we want you to continue to come to counseling, because counseling services will help to reinforce your recovery objectives and your recovery network.
If you need to cancel your appointment, we ask that you contact your treatment advocate in advance so that we can cancel that and reschedule it for you.
If you come back to the primary care doctor's office and you've used heroin, then you definitely want to talk to your doctor about what happened and what led up to you using the heroin. In that situation, you would generally come back more frequently to be tested. And if it becomes a pattern, if you use regularly, then your doctor may make a suggestion that maybe you would transition back to more intensive care.
you are no longer a client that really needs acute services at this point, you can now transfer to a continuing of care where people can provide the necessary services that you need, but in a different manner. So you will open up a slot for someone that really needs acute services in terms of treatment.
When you transfer to a primary care doctor, your Baltimore Healthcare Access treatment advocate, your counselor, your nurse and doctor will all be aware that you're going through this process, and they will be in communication with your new doctor. So all of the staff people at the program will be working to help you to make that transition as smooth as possible and successful for the long run.